And I've got one more of my guests coming in a while after his documents had arrived. So we should be able to start whilst we wait for the others to join us in due time. And the topics we are looking at, you may have heard that Finance Minister announced that President Akufo-Addo had said in London very recently, quote, "We no longer want to offer justification for those who want to be rude and abusive to Africa and her peoples," unquote. Yet, as the president spoke to Macron, he said, among other things, that we won't look a horse in the mouth. So, what are we saying? Is it really growing a Ghana beyond aid, or it's just something we admit it's impossible to do because of our own attitudes? The question we're asking on Newsfile this morning is, what next after the nice talk? And I also ask whether authorities have done more than look on as students of KUMCA die like chickens stricken by disease. So far in the year, in the last week and 6 months ago, a total of 11 students have died. We're getting to learn what exactly has been the cause. And again, it's been a week full of anti-corruption campaigns as we learn that ghosts rob Ghana 30 billion cedis each year. Shall we ever succeed in the corruption fight? That is the question. So let me introduce my guests and let's begin the discussion. My guests in the studio, in the order of who came first. Nana Akomia is Managing Director of the STC, former Director of Communications of the NPP. Good morning, Nana, and welcome to the show.
Good morning, Thompson.
Great to have you. Also in the studio, Abdul Malik Kubako, Editor-in-Chief of the New Crusading Guide newspaper. He's our regular panelist. Good morning, Senior. And Dr. Emmanuel Akwete, he's Executive Director, Institute of Democratic Governance, IDEG.
Thank you.
Sure, they have been part of the corruption campaign that the week has seen in flight. Welcome once again, sir.
Thank you.
Great. We will soon be joined by Samuel Okujeto Ablakwa, who is MP North Tongue and Ranking Member, Foreign Affairs Committee of Parliament. Now, we should be able to start with what is going on in KUMCA. That is the Kumasi Academy, and that school, unfortunately, 6 months ago, suffered a very terrible situation where students die mysteriously, and later on it was found out to be some meningitis. Really, was it that? Now, as you know, again, disaster has stricken the school, and total of about 7 or so have died as a result, and there are upwards of 40 or so that have been in hospital. And the Health Ministry now gives us information about exactly what's been the cause of these deaths. So we can look at that now and then move on to the other issues. We want to start by getting to speak to someone with the World Health Organization, who is a representative in Ghana, to give us a lot more education about what has gone on, because they have also been at the forefront of ensuring that this situation is contained. But let's begin with listening to the Health Minister as he revealed what exactly was the cause of the deaths.
Fortunately, the outbreak is so far confined to a small area in Kumasi Academy. It hasn't spread to even the very nearest town where the school is located. Challenges, panic, and parents' demands, some media misinformation, politicization of the events, spiritualization of the outbreak, and inadequate PPEs. In conclusion, an outbreak of acute respiratory illness has been confirmed in Kumasi Academy Senior High School. The outbreak began on 30th November 2017. As at today, a total of 44 cases, including 4 deaths, have been reported, resulting in an attack rate of 14 per 1,000 population. The Ministries of Health and Education and the Ghana Health Service, as well as the Ghana Education Service, do recommend that students should remain on campus to enable final conclusions on response actions. We are strengthening surveillance on the condition. We are also in collaboration with the World Health Organization, taking immediate steps to access vaccines as part of our response measures. Steps should be taken to enhance school health at Kumasi Academy and nationwide. We are procuring antiviral agents, Tamiflu, for case management. We're also strengthening case management, including strict adherence to infection prevention and control measures. We also want to complete all outstanding laboratory investigations and the autopsies remaining to be done. We have intensified our public education and we continue to so do. Following the review of the case definition, appropriate samples, that's throat swabs, were taken and immediately sent to Noguchi Memorial Institute for Memorial Research and Kumasi Center for Collaborative Research, again for further laboratory investigations. Of the 19 samples sent to Noguchi, 12 tested positive for influenza type A. About 2 hours ago, report on further tests was received confirming influenza type A H1N1 29 pandemic strain. We are awaiting the results of samples sent to KCCR, and we're not expecting that will be very different from what we have found from all the other research centers.
I must say so, that we put the president at risk. So until we identified other things that suggested that we should go ahead and do more investigations because it was in meningitis, the president had already visited, and that was a challenge. So between Friday and Saturday, right, nobody would have thought that this was the situation that we're going to go through. So although we put the president at risk, that is correct, I must say that. But it was based on the type of situation that we had because of the earlier incident.
Has the president received some treatment, or can you not yet confirm that?
He has been tested. We have looked at him. You know, when we realized that he went there on Saturday, without us stopping him, we alerted his doctor, and I think the president is in very
Right, so you have been listening to the Health Minister, Kweku Agyeman Menu, who has been giving updates and talking about what exactly has been going on so far. And in fact, he also spoke about the president being allowed to shake hands with some of the students and teachers when he visited the place 2 days or so after the infection had already started. And I think 2 people had died at the time, or was it? And how they had exposed the president to such risk, and whether or not he had received any aid to that effect. And then you also saw, for those of you who are watching, you saw the parents join their children and guardians join their wards there in the school in a prayer session to ask for God's intervention. Let's go to the phone lines and speak to Dr. Owen Kalua, who is World Health Organization's representative in Ghana. Good morning. Thank you for joining us on Newsfile, sir.
Good morning.
Right. What has been the World Health Organization's intervention, of course, collaboratively with health authorities in Ghana over this incident?
Thank you very much. First of all, let me, on behalf of myself and my organization, express our sadness at the loss of life of the 4 students as a result of this outbreak, and also to express our sincere condolences to the families that lost their loved ones. We consider, as an organization, any loss of life as one too many. And under such circumstances, we always do our best to make sure that we get to the bottom of the causes of the problems and how best to address them. Mm. So in this particular case, we have collaborated very well with the Ghana Health Services, and we have had one of our experts on the ground working with the team there, really to try to quickly respond to this problem, to try to find what was the cause of it, and also to ensure that those that were sick from this get the best care as much as possible so that we minimize loss of life. And I would like to say that indeed the team on the ground in the region, led by Dr. Tinkorang, did quite a good job, and also the various institutions that were caring for the patients, as well as the labs that were involved in the analysis of various samples. They did quite a good job to get us to where we are, that we are quite sure of what is the cause of this problem now, and that we can have concrete steps to addressing it.
Right. Is this not a situation that could have been preempted? Because that's the suggestion, that if we had had similar situations happening and deaths occurring 6 months ago in the same spot, in the same school, then it is health authorities that have let these children and the parents down.
Not necessarily, because if you look at the previous problem in the school around April, that was different conditions to what we're dealing with now. And at the same time, we should also realize that we're dealing with a condition with a fairly short incubation period. In other words, from infection to when the clinical signs develop was quite fairly short, and it also had a very quick course. In other words, patients who are infected with this particular virus, as we know now, quickly, the progression of the symptoms were quite quick, and unfortunately led into death fairly quickly. So when one bears all that in mind, one really cannot place the blame squarely before the health authorities. I would like to think they tried their best once they were informed to try to arrest the situation as soon as possible.
Mm. But would you also say that in the recent development that the health authorities were fast enough? Because it seems to have taken almost close to a week to now be fair about what was happening and to determine what correct treatment that was supposed to be administered.
I think yes, given the circumstances, one can say so. Because for one to be able to put a finger on what it is, in many cases one will have to go through a number of tests and analysis to really come to the bottom line of it. So I think it was reasonably quick. But I think at this stage, really, we would not be evaluating what happened, what would happen. Normally we do that after the epidemic or the outbreak is over. It has been declared over, then we take our time to look back.
Okay.
So that we can learn lessons, we can see where we could have done better, we can see where we did better, therefore we should reinforce. And as an organization, when we do that, it's not just to help the response next time in a particular country, in this case Ghana, but also to share some of the lessons and experiences with other countries that might in the future be facing similar situations. So yes, we do that.
Right. Let's be quick about the education. Let's be quick about the education at this point, since we cannot be crying over what, as you say, has already happened. Let's be quick about some education that we need, everybody else needs, to be able to detect or avoid catching this H1N1. What should we look out for?
I think at the moment the major communication to the public really will be one to do with personal hygiene. One can talk about hand washing, cough etiquette, and all those kind of things are quite important at this stage. And also to inform people really that to seek health care early when they have this kind of signs of high fever, etc. So I think that's one of the things that should be happening, and that's the thing that will be happening. I say that because I know that now going forward, all the subgroups of the National Technical Committee for responding to outbreak are being activated now that know what we're dealing with, so we can chart a clear way forward. That's the risk communication group, strengthening surveillance, in other words, the surveillance group to see what is happening, and also to the issue around case management and infection prevention and control. So all these groups will be reactivated to do their job, so that indeed as we go forward, we minimize any further outbreaks related to this.
Indeed, as part of the education that the World Health Organization wants to give to everybody on how to protect oneself and others, you have put out this information, and you say cover your nose and mouth with a disposable tissue when coughing and sneezing. Regularly wash your hands with soap and water. If you have flu-like symptoms, keep a distance at least 1 meter from other people. Avoid hugging, kissing, and shaking hands when greeting. And also dispose of used tissues properly immediately after use. If you have flu-like symptoms, seek medical advice immediately. If you have flu-like symptoms, stay home from work, school, or crowded places. I'll come to that shortly. Avoid touching eyes, nose, or mouth with unwashed hands. But here, you say, stay home from work, school, or crowded places. The danger that is being spoken about now is that those who went to the hospital, 40 plus of them have been treated and discharged. In the majority, they are returning to their homes. Some of the parents and guardians went to the school and insisted on taking their kids and their children and walked home, and they did. So that exposes the risk of other people getting it. Quicker spread. Is that not the case?
Well, I think part of the response will be to look at the issue of contact tracing, so that all the people that have been in contact with those that have fallen sick in the days preceding the event and after have to be followed up. What it means is, therefore, to be able to identify them and to be able to follow them up in terms of developing suggestive symptoms or flu-like symptoms, so that you are able to, first of all, manage them early, if that was the case to happen, and also to be able to take the necessary samples for analysis to confirm indeed that is the situation, so that you can be able to contain it quicker. So that will be one of the aspects that will be looked at. To look at that, and also the communities where the various contacts would have been, so that you can be able to trace the contacts. Yes.
Is it an assurance you are giving that the team of medical personnel are ensuring that there is effective contact tracing so that those who have gone home do not infect others?
I think I would use the word assurance, because if you say that, you are saying I'm 100% sure. But what I'm saying is that's one of the things that has to be done, and has to be done well.
Okay.
And we'll be working together with the various teams that are doing this to ensure that that does happen. And also just to state that as an organization, we also have had our own meetings with our colleagues, rather discussions with our colleagues in the regional office and headquarters, our experts in this area, and all the recommendations that they provide, will bring them to bear to the authorities, and to make sure that all the recommendations are being implemented. So, can I give an assurance? Not necessarily give an assurance, but what I can say, we'll all do our best to ensure that we minimize further spread of this outbreak, so that we protect people and we save lives.
All right. Thank you very much for your time, sir.
Thank you.
Right.
It's my pleasure. Thank you.
Thank you indeed. And some very good education for all of us there by Dr. Owen Kaluwa, who is World Health Organization's representative here in Ghana. And most importantly, it's about the education on how to protect yourself or avoid catching H1N1, which is the cause that has been identified for the deaths at KUMCA. Wash your hands often, and you do so under running water with soap. Cover coughs and sneezes. Stay home when you feel sick, and more importantly, quickly ensure that you are speaking to your doctor or you are getting out to the nearest facility. Nana? Yes, very, very devastating. I can't imagine what the parents are going through. And those who went to the school and insisted that they needed to take their kids, their children away, because this is not the first time in the year it's happened. And of course, we say it was a different matter, but it also involved deaths. I mean, what do you say?
Well, thank you, Samson, and let me wish our audience a good morning, and also my co-panelist. The NDC is missing in action. Yes, our condolences surely must go to the parents and the families of the students at Kumasi High School who lost their lives at such tender ages. It must be very terrible for the parents. And if there's any support, they deserve it all. I'm happy that the government has made contact, and there's definitely some plans to alleviate their losses. Beyond that, the health situation in the school, there is some, for me, there's some lingering difficulty that I would want to see resolved. So in April this year, there were a number of deaths, at least 5 deaths. Now, we have all been to secondary school before. Now, if in one school, even a single death, I remember when I was in secondary school in Cape Coast, and there was one death. And this young man, who was, I think, a year or so behind me, he died in a car accident. But the turmoil in the school, as a result of the death of that one person who died in a car accident whilst on a trip from Cape Coast to Takoradi, I think. We were traumatized as students. People would not go to bathrooms in the evening or in the night. People would not go to the classrooms to learn in the night. We were extremely traumatized. So when you have a situation where there are 5 or more deaths in one school, it's a situation that should immediately have triggered a major alarm. That it did not trigger a major alarm. And indeed, I think some short time afterwards, the president himself visited the school because the school was celebrating an anniversary. And those 5 deaths did not trigger any alarm. For me, it's an issue that has to be looked at. 5 deaths in one school should immediately have triggered an alarm. Then it seemed to have died off. A couple of months later, so this was in April 2017, so May, June, July, August, September, October, November, 7 months down the line, you have in the same school another 4 deaths in the same one school. And this time, it triggers the alarm, and every institution that should get involved is involved, including the World Health Organization, and the measures are being taken now. So for me, the lingering difficulty is that if in one small location you have 5 or 6 deaths in 1 or 2 months, and then 7 months down the line, the same location, you have another 4 deaths rapidly, and another maybe 40 or so with infection, and have to have emergency treatment. For me, it tells me that there must be some source of infection in that location. That must be looked at. Beyond the treatment, beyond taking care of the people who lost their lives, the families of the people who lost their lives, and beyond taking care of the students, I understand that it's now being contained, the proper medication is available, and those who were admitted have all been stabilized and they've all gone back to school and so on. But beyond that, if in one location you have all of these deaths, all from viruses, the first virus I understand was meningitis, and so when 7 months later the deaths and infections came, it was thought that it was meningitis, but it didn't turn out to be meningitis. It turned out to be swine flu, which is also a virus. So one location, you have 2 deadly virus infections causing deaths. We must get to the bottom of it. You remember when the Ebola thing started?
Right.
They had to trace to find the first person who contracted and how that contraction of the Ebola could have happened. And then you take care of the source of that infection. And so I'm hoping that going forward, that job will be done, because you don't want in another 11 months in the same location, another virus infection breaks out and people die. That one, it will be completely unforgivable. And all of us will be extremely angry if it happens again. So I'm looking forward to extensive work in that locality and some proper identification made as to the root of all of these infections going forward.
Okay, thank you very much. And like I mentioned earlier, a lot of the education is important. And so a good friend of mine from the NCCE, the communications outfit, sends me this one. I think if that's what the NCCE is also doing, then they ought to be applauded. a very simplified, easy to appreciate form of, steps for persons to take. They say that these are the tips that you need to follow, that influenza is the only respiratory virus preventable by vaccination. Then make sure that you are washing your hands, wash them often with soap and water. Keep sanitizer close, use it often, and tell children and those around you to do same. Don't touch your face. This is the easiest way for germs to get into your body. And also, studies show that smiling can help boost your immune system. Okay, so this is an interesting part of it. Eat healthy and balanced meals can strengthen your immune system. Also, it is important you need exercise to boost your immune system and speed recovery from illnesses. So this is sort of a general thing that's being given out. Stay home for full 24 hours after your fever goes away. But if you do detect that you have flu symptoms, quickly run to the hospital. And they say H1N1 prevention is cure. Prevention is cure. Doc, yes, from where you sit, having observed the intervention so far, what do you have to say?
Thank you very much, and good morning to audience and colleagues here. I think, first of all, I'm happy the situation has been brought under control, and there is probably improved knowledge of what was happening. And I think the interventions have been swift and assuring. Public education has also gone up high. But I more or less belong to the issues or the side that so Honourable, is it, I retain it, Honourable former Minister of Information, or now the public transport guru.
In a can, the name or the title Nana is everything.
So Nana Kumia. So I belong to Nana Kumia's perspective on the issue, that because it happens to be the same school, KUMCA, and the 7 months interval, I've always wondered what happened. Because indeed, I thought that because the school had 60th anniversary coming, which was extremely important, they might have known probably that they had secured the president's confirmation to come. It was such a big thing for them. And usually it will be a time that you want to do everything in the school to make it a very safe environment. The president is coming, it's the 60th anniversary, the school must look good and at its best. So I'm wondering what took place in that 7 months interval to make sure that what happened and the causes, you cannot say it's a place friendly to virus. You'd rather want to know that the health authorities have done their work properly, the assembly people, the sanitation issues have been looked at thoroughly. Everything is being done because, first of all, I feel that the trauma of the first death itself, it's something that will weigh heavily in a situation where we are also very superstitious, you know, and students, it will affect the students, whether you like it or not. Parents will be extremely afraid. And for it to happen, you know, the second time, and when even before the event of the president, but we seem to have been so casual about it, which makes me sometimes think that we are more focused on reacting to situations than preventing recurrence. And that for me exposes us to greater danger. And I think that probably procedures ought to be put in place now Is it that some regular checks would help? Is it that various other agencies? Health is not just the Ministry of Health. I think what the Assembly, those who take care of sanitation, those who also go regularly just to make sure that environments are pretty much healthy and clean and so on, and that if there is anything, there will be such quick intervention to assure people deal with their psychological, their trauma, and other issues are there. So it's raising a lot of questions. For me, I think KUMCA is only telling us that we ought to be better prepared and probably do more thorough examination of all the schools to see what it is, who comes in, who goes out, and so on. I was very confident that they would rein in this because of the way we prepare towards Ebola. And I think we have the facilities apparently.
Yes, because we became a hub and we received a lot of...
Yes. So I wish that same attention had gone in here and this had been prevented. But it happened, and sad, it's very, very sad. I mean, parents who had lost 11 in the same school is a lot, and I think it's going to traumatize them for a long time, and probably other measures should be taken to deal with the trauma in the school amongst the students and then also the parents. I mean, it's good to take care of those who've lost loved ones and those who are sick, but I think it's affected the whole community.
Right.
And we should look at the various ways in which greater assurance will be brought back. It's a safe environment for studies and for parents to leave their children or send their children and focus on other things. That for me is the next step.
I can't imagine what the students are going through, that they would even have the presence of mind to be focused on their studies.
Yeah.
Koku?
Yeah, I really wonder. There isn't much to add to what Nana Komia and Doc Akwete have said. It's just that because it's a tragic event and families have lost their loved ones, you feel like saying something. Otherwise, the truth of the matter is that what they've said is sufficient to represent the way we all feel, But I hope going forward, these tidbits of education, what we're being told, what to do, what not to do, will be, amplified and expanded so that many people will get to know. I sit here, I've not read much about it. I have to be honest with you, I'm not very well informed or educated on this matter. The only thing is that it hits you because people are dying, So I hope that dedication will be intensified.
And while people are dying, the school authorities and all those who are supposed to be involved, are thinking about an anniversary that they are taking care of, and they feel things must just go on.
Well,
and they are continuing whilst people are dying.
Well, it's legitimate to raise that point. Maybe there's a certain level of insensitivity, somebody might say, but I want us to look forward. The tragedy has occurred. Somehow we are managing it, even though I'm not too clear, because I'm told Dr. Bedu Sakwadie, he's the director of the Ghana Health Service, says that the causes that have been found yet put out there is not totally conclusive, and that we should be careful we don't jump to premature conclusions. So one would just be guided. I think when these things happen, because it's sensitive, delicate, tragic, we all can talk some, but sometimes we should leave the space for the experts and for the appropriate institutions. It's good to hear Nokuchi and the rest are coming.
They took as many as 19 samples in Nokuchi, and it is 12 that tested positive for the influenza type A.
I'm happy to hear that in terms of our local capacity, even though there's collaboration with the World Health Organization and all the rest, we are growing a certain local capacity to deal with some of these things. But I think the most disturbing aspect too is this also Fumokos and prophets and religious elements.
Quite reckless, if you ask.
Yeah, I find it too difficult to accept. It's rampant these days on everything. Somebody dies and they come, oh, I said it. When you ask what he said and you try to do a check list, it doesn't equal. But that has become a phenomenon. Yes, I agree. We're quite a superstitious people. You know, there's something, a missing link somewhere. But it's about time. This was Sophos.
What have they said again?
Oh, you haven't read?
I haven't monitored.
What the so-called charlatans in Kasok in the name of prophets? You haven't heard what they are saying in town?
I haven't monitored.
Oh, they are attributing all sorts of stuff to what is going on. And some of them have bigger names in town.
Yes,
it's shocking.
It's not good. It adds to the panic, the fear, the lack of education. You know, people won't take an informed basis. So all the things NCC and others are saying, the WHO person said, some people will ignore them.
They're getting parents to panic.
Yes.
And even some to abandon that school for forever.
We have to be careful. It's a phenomenon. It's not that it started today, but it's getting very rampant.
It's becoming an industry.
Yes, actually, that's the appropriate word. You know? So I'm worried about that aspect. I don't know. I know democracy creates room for ugly noises, but I don't know if this kind of ugly noises at the time when there's, you know, serious issues, it's something that we should be encouraging. Maybe the media should also start doing some, self-policing. I mean, who do we give the platform to? Right. How do we do it? I know it's difficult on social media to
some of them have airtime on radio, yes. So they take their turn,
yes,
and they begin to
speak all sorts of, we have to take another critical look.
Ignorance.
This is self-regulating. We ourselves. I'm not asking any authority to intervene or to sanction or punish. That's not what I'm asking for. But I'm asking that we ourselves, from the professional and ethical point of view, should be able to, deal with some of these issues. Otherwise, I associate myself with it. Yeah.
Yes. Just to add to that, I think that the way to deal with superstition and the so-called prophets' explanation of things is to sustain first aid education on some of these, near epidemic situations were found. What are the simple things that we should do? Right. If you look at what has been we were told to do, and when Ebola came, you'll find out that there are elements of it that are consistent things we should do. Do we sustain this education? I think when people feel they know what to do to protect themselves and so on, the charlatans will not have the immense effect they tend to have.
I agree.
And school compounds should not be the places where there's such huge ignorance, that people panic easily. Okay. How could it have been explained better? And I think that it is important to probe of how the response, how was this handled in that interval, April 2? What did the school do? I think we need to understand.
Including, of course, putting the president at risk.
Yes, the president at risk. I think that's why I said the institutions involved must come together.
There are some who are actually suggesting that the health authorities, some people should begin to look at taking them on for some form of negligence in this regard.
That tells you that we react to things, but we could have prevented a whole lot. But how was it managed? Because it would be instructive to the preventive education that should come subsequently.
Right. Thank you very much. We've got to take a break and come back and move on to some other discussion. And we'll be going to Ghana Beyond Aid. Ghana Beyond Aid. But let me repeat the education. And please, like Oku said, just simply ignore those rogues who claim to be prophets in the things that they do. I mean, most of us, we are Christian. I suppose all of us here, if you are not Christian, Muslim, and you believe in God, I believe the scripture, and I believe in all the giftings that the Bible talks about, word of knowledge, prophecy, and all of that. But this is what we're using is. Okay, so this is how to protect yourself and others. Cover your nose and mouth with a disposable tissue when coughing and sneezing. Very simple to do. Dispose of used tissue properly immediately after use. Regularly wash your hands with soap and do so under running water. If you have flu-like symptoms, seek medical advice immediately. If you have flu-like symptoms, keep a distance of at least 1 meter from other people. You love your friends and your children and your spouse. Don't let them also catch it. If you have flu-like symptoms, stay home from work, school, or crowded places. Don't take it to church and to the mosque or to work. Avoid hugging, kissing, and shaking hands with others. And also, when you are greeting, don't just hug and shake hands. Avoid touching your eyes, nose, or mouth with unwashed hands. This is from the World Health Organization. Thank you very much. We take a break. When we return, Ghana Beyond Aid, rhetoric or something we will really pursue.